number of different sort of resources forward right now, knowing that people need different sort of things right now, and it's such a crazy time. And so we tried to put together, sorry, clearly I can't talk and read in the chat box, but Mark Schneider wanted to know who to pay for lunch today. So I would like to ask, when we start with our speakers, if you want me to bring any documents up, I have them ready right now, and I can bring those up while you talk about them, or if you just want people to know they're there and you just want to talk and not have a screen share, just let me know. I'll just have each of you advise me at that point. But just so people can see, I'm just going to show you really quickly.
Leanne has joined us.
Thank you. So here is the document that we put together with some quick links in there to connect you to the different sort of resources that folks shared or that we thought might be helpful right now, and I'm sure there's a million more, but this is what you'll have access to. Sorry, I have a desktop and a laptop going, so, and then when you get to the share drive too, there's all the different, there's a number of resources which we can add more to that as well. So Leanne, I think if you're comfortable with it, I'd like to start with you. And so would you like me to bring up either of the two resources that you sent to me at this time, or do you want to just talk? Oh, you're muted.
Can you hear me now?
Yes, and I'm sorry, I forgot one thing. Could I ask all of our speakers to please just introduce themselves as we go through? I thought that might be the easiest if people aren't familiar with everyone. So I'm going to turn it over to you, Leanne.
All right. Good morning, everybody. I'm Leanne Moskowitz, Iowa Medicaid Enterprise, Department of Human Services, Iowa Medicaid Enterprise. I'm a long-term services and supports policy specialist. I work with the HCBS waiver programs, the state plan, HCBS habilitation program, as well as other Medicaid services. So, and I'm employment policy specialist for Medicaid, work hand in hand with my partner over there at MHDS, Lynn Nibbling, on employment policy for the department. So I sent a couple of documents over this morning. I apologize, I wasn't able to get that over yesterday. But for as far as the update document that I sent over, I think you'll find there are a number of helpful links. I know probably on everybody's mind right now is COVID-19 and how the department is responding to COVID, the public health emergency, and its impact on our members and providers. And so I've provided on that document some very helpful links for folks to get their questions answered regarding COVID and what we're doing. Some of the things that we've done is we've asked the Center for Medicaid and Medicare Services for a lot of flexibilities around Medicaid policy to enable services to continue for members and to continue Medicaid members' eligibility during this time, as well as expand some services to populations that might not necessarily have access. So some of those, we do intend to maintain Medicaid eligibility for anyone who was eligible for Medicaid prior to March 18th. That is the start date of our flexibilities that we've been granted through the Center of Medicaid and Medicare Services to maintain all Medicaid members' eligibility. We will be doing that on a rolling 90 days up through the duration of the public health crisis. That includes the HCBS habilitation population. I've gotten a few questions last couple days about the state plan HCBS members. If you all recall, to be eligible for habilitation, you must first be Medicaid eligible in an eligibility group that has access to the state plan services, as well as have income that is at or below 150% of the federal poverty level, and that is a federal requirement for participation. We are currently working today to put through production the removal of those income and eligibility edits for habilitation that would typically cancel habilitation for someone. As soon as those edits have been completed through production, myself and a couple of the medical services reviewers for habilitation intend to go back into the individualized service information system and reopen all of those HAB members who have lost habilitation beginning March 18th. We're going to extend their eligibility out through June 26th at this time. We'll reevaluate on June 15th where we're at in terms of the public health crisis and extend for another 90 days at that time if warranted. Once it's concluded and it's determined that the public health crisis is no longer in place, and that'll probably be related to a proclamation by the governor restoring the previous standards that were in place prior to the flexibilities being granted, members will be notified that their eligibility will be returning to pre-COVID status unless other circumstances exist at that time that would lead to their eligibility continuing. So I know that's a lot of information. I think the bottom line is that people need to know they're not going to lose their services and benefits during COVID-19. We've also waived Medicaid, the premiums and co-pays, and that includes for folks with Medicaid for employed persons with disabilities. People need to know that their stimulus payments that they received is not going to be counted as income as long as it's spent within 12 months of being received. So that information is located in the COVID-19 frequently asked questions documents that we've provided, as well as the toolkit. I know it's called a provider toolkit, but it's a very helpful toolkit for all folks who are concerned about how Medicaid's responding to the COVID-19. Let's see, what are some other questions? As far as unemployment income, yes, people need to continue to report their income and changes in their income to DHS. However, again, the paycheck protection payments that folks are getting, the additional $600 a week that they're getting in unemployment is not going to count against them for income for their Medicaid eligibility determination. So you need to know that as well. And again, you'll find that information in those links provided by the department. Some other helpful information, we did expand HCBS services of home delivered meals, companion services, and the homemaker services to HCBS waiver members who didn't previously have access to those services. We've expanded it during the public health emergency again, starting on March 18th. If a case manager or a care coordinator identifies that an HCBS HCBS waiver member needs those services, they can go in and authorize those services in the individualized service information system, or work with the member's managed care organization in order to add those services to the service plan. Now, again, the expansion of those services is to address when there are care gaps or service gaps from the typically authorized services for that member. So I usually have someone come in and help me through daily SCL or through home-based habilitation to prepare my meals, assist me with shopping, those kinds of things. And due to COVID, those normal activities can't continue or aren't able to continue. I used to go to the meal site a few times a week to get my meals. Again, it's to provide a gap in care. And so, or provide for a gap in care, I should say. And so folks under those circumstances can't have access to those additional services. We've also expanded meals to the entire Medicaid population, so non-waiver members as well as the habilitation population. And so if someone needs meals, it's important to, if you're a fee-for-service Medicaid member, we don't want anyone going hungry. Please call member services, reach out to them. They will connect you with meal providers in your area to get meals going. Same thing for the HCBS habilitation members. Again, reach out to member services. The IHH care coordinator can do that, or the member themselves can do that. All of these expanded services will be running through either the MCO or through the IME prior authorization process. And there's an informational letter that details this out and gives these instructions in the 2-page document resource that I sent over this morning. Other things, telehealth is a big thing. We've answered a lot of questions about providing services via telehealth. And what we have determined is that any Medicaid service that has been identified for the member that is clinically appropriate to the member's needs may be rendered via telehealth. And this would include job coaching, some of the individual supported employment activities, and other activities that may be rendered appropriately via telehealth, video conferencing, teleconferencing. And when I say telehealth, I'm talking about all encompassing, talking to somebody on iPad, their iPhone, through a video link, those types of things in order to continue to render the services. So it's important to know that. And there's an informational letter that provides instructions to providers on telehealth, and then billing for telehealth as well. So there's been a lot going on. there's a lot of informational letters out there and nice resources, and we continue to update that provider toolkit just about every day, or as we get new questions in that we need to respond to. And so we also update it as we continue to work with CMS on additional flexibilities. There's been a lot of questions from the provider community about retainer payments to HCBS providers who weren't otherwise able to render services to members due to either closing as a result of the governor's proclamation for social distancing, groupings of 10 or less. She did come out early on with the proclamation of closing those large congregate like day have centers, those types of things, adult daycare. So if a provider had to close down a service line related to COVID, or was unable to provide a particular service that's been identified by the department, day service, to members, we are working with CMS and have a call later today about being able to make retainer payments to those providers. The department is working very aggressively. We would like to be able to start receiving requests from providers within the next 2 weeks and start making payments shortly thereafter. And these payments will flow through the fee-for-service system. We're working out the details. We have an informational letter in flight with leadership right now, as well as the provider retainer payment request form. And so stay tuned. You should see more information, hopefully towards the end of the week, on being able to access those retainer payments. Let's see what else. That's probably the big highlights for the COVID. We did get a couple of additional questions that Denise had sent in, and I'm going to see if I can find that email that I sent over to Amy with those questions. Let's see here. Oh, wrong one. Let's see. Here we go. So a few of the questions that came in from Denise was, with clients going on expanded unemployment and getting that extra $600 per week, will this count against them to remain HAB eligible? And then we talk about between that $2,400 regular unemployment, SSDI clients are going to be above that income cap. And so, as I said earlier, the federal pandemic unemployment compensation payment that are issued to individuals receiving unemployment benefits and the amount of $600 per week are not countable as income for Medicaid members during this period. So that will not count against them. The other question that we got is, as things start to reopen, there are clients who are off, they're getting calls back from their employers at a significantly higher rate of pay when they come back to work. Some of that is done through the small business loan programs where the paycheck protection requirements that the provider utilize 75% of those dollars towards the maintaining their employees and towards employee reimbursement. And so the question is you know, they're going to make a much higher rate of pay, and this is temporary, and how will it impact their eligibility? And the requirement for Medicaid members to report their income has not changed. Members need to continue to report income changes to their DHS worker, and the additional income could impact a member's eligibility post-COVID. But as I said, right now at this time, we're maintaining all of Medicaid members' eligibilities that were in place on or before March 18th. And going forward throughout the duration of the crisis. So that's not to say that that higher income would not necessarily impact someone. It could impact someone once we go back to the standard Medicaid eligibility determination processes post-COVID. The other question is, how should participants in the MEPD program anticipate what they should do in order to continue their enrollment, working at least 1 hour, and the effect of unearned income they received? And so the question is twofold, and we've provided responses, similar responses out on the members' webpage as well as the provider toolkit. So during the emergency declaration, will unemployed individuals be allowed to keep their Medicaid benefits and be excluded from unearned income that they received during unemployment. And the response is, during this declared time frame, loss of SSI benefits due to unemployment benefits will not disenroll an individual from Medicaid. However, when the declaration is lifted, if the member is no longer eligible for SSI, they would take appropriate action to redetermine eligibility under another group. So that's, like I said, post-COVID, we will be going back to the standard Medicaid eligibility determinations. And then individuals on MEPD who are not able to work right now are concerned about losing Medicaid during this time. Is there any option to waive this expectation during these circumstances? We did request a waiver from CMS that includes an extension of eligibility. And so this extension of Medicaid eligibility during the public health crisis includes our MEPD folks who would otherwise be required to work in order to maintain MEPD. So again, we're extending Medicaid eligibility for all Medicaid members throughout the duration of the crisis. So, are there any questions before I go through the employment data real quick with folks?
Leanne,
I know we're like short time today.
Leanne, Bill had a question. He said, I hear people are concerned their direct care workers are coming into their home without proper PPE. Any resources and or comments about that? And Bill, you're welcome to yourself as well.
Sure. So as far as what the department is doing to ensure, we are responsible for the DHS RAN programs. And so our focus with the delivery of PPE, et cetera, has been to work through the DHS contacts, getting them out to the resource centers, getting them out to the various locations that are operated by DHS. Now on the provider side of things, I know that Shelley Chandler's group with the Iowa Association of Community Providers has been able to obtain some PPE and provide that to providers. I know a lot of individual providers have been seeking PPE in order to provide that to their employees. We are not getting widespread reporting from the provider community, but we have reached out and asked that the provider community do contact us if they have identified a need, as well as contact the governor's office, because there's other things that can be done at the state level to get PPE to providers. But providers are being asked to follow the Iowa Department of Public Health's guidance for long-term care that is published out on their COVID-19 webpage. So if you go to idph.gov and there's a link right there at the top of the page for COVID-19 information, go to that webpage and you will find a list of all of the guidance provided for the different healthcare providers, long-term care providers, daycares, etc. Does that help?
Leanne, oh, I'm sorry. Go ahead, Scott.
This
Hi,
is
Scott.
Scott. Hey, could you talked about income related eligibility. What about resources? Resource eligibility.
Yep. So resources also. So again, we're maintaining all of the Medicaid eligibility for folks during this time, and the stimulus payment is not going to be counted as a resource. The unearned income is not being counted during this time. So as far as the resource calculations go, once the public health crisis is over, we will resume the normal eligibility determinations, looking at countable income, resources, et cetera, with a couple of disallowances as far as that stimulus payment being utilized within 12 months of receipt, not being counted as income or a resource. So again, more detailed information is in that provider toolkit, as well as the member page link that I've provided.
So it is at least 12 months at this point? Or is that dependent on the end of the crisis?
No, for the receipt of the stimulus payment, we're considering that 12 months. So as long as it's spent within the 12 months of receipt of it, it's not going to be counted as income or resources, regardless of when the public health crisis ends.
Leanne, I got a question sent in where someone wanted to know, a provider wanted to know how they should be billing during the month of April if individuals aren't meeting their job coaching tier due to decreased hours. And they said their understanding for March was to bill as we normally would, like a half month of normal services, but with April being the second month of shortened job coaching services provided, mainly due to decreased hours from employers, how should they bill?
Right. So we also provide a response to that in the provider toolkit link that has been provided to you all in the document that I've given you. And so in the toolkit, what we have indicated and what the both AmeriGroup and Iowa Total Care have stated is that the provider and the case manager should work towards identifying the correct tier that the member should be authorized for based on the actual amount of service that that member is going to receive during the month. And of course, as I said before, we're working on identifying or receiving approval for retainer payments in order to try and compensate providers in part for the lost hours, lost revenues related to not being able to provide typically authorized services. So they should absolutely reach out to the managed care companies, case managers, in order to make changes to the member service plan to accommodate for the time with them not being able to receive the full service. We did actually answer, I believe, the specific question in our provider toolkit. I was just going to look real quick for the response here. So we talk about another thing. Yeah, let me find that real quick. Kind of got questions spread out in here. So we talked about I'm looking to see if I have it in here. Here we go. So we do need providers, again, to work with the case managers to modify the service plan and service delivery. And that would include if services are going to be rendered via telehealth. It would be good to discuss that with the case manager and ensure that gets documented in the service plan. If it's a member who would normally require that face-to-face, hand-over-hand, maybe assistance in job coaching, again, based on individual need, how are we going to render that service in this new normal, and work with the case manager to make sure that services are properly authorized in the service plan going forward, since we're looking at full months of service here. And then of course, once things are returning to normal, the member starts working additional hours, provider has the staff in order to render the service, then things can return to the previously authorized service. But for the interim, if things have changed, that needs to be communicated with the case manager and services should be properly authorized. That help?
Yeah, that's great. Thank you,
Kind of a
Leanne.
long answer to a short.
No, that's complicated. There's another question that came in. Are the Iowa Health and Wellness members eligible for delivered meals?
Yes, all Iowa Medicaid members, regardless of their eligibility group, are eligible for the expansion of the home delivered meals to the entire Medicaid population. They need to call in if they don't, if they're not part of rehabilitation and work with a care coordinator or a waiver and have a case manager, they should call into either their managed care company's member services line and request meals, or to the IME member services line to request meals. And again, there is a specific set of criteria in order to access those home delivered meals for the non-waiver population. And the criteria is outlined in that informational letter. And what we talk about is that the member has to be at least 18 years old. They have to be homebound as a result of COVID-19 public health emergency and be part of a high-risk category. So they are members over the age of 60 or members who are between the ages of 18 and 60 and diagnosed by a physician with a serious health condition that puts them at risk, such as heart condition, chronic medical condition, or compromised immune system. Members over the age 18 and diagnosed by the physician who fall into the high-risk category, or members who are children under the age of 18 who reside in a household of someone who is otherwise eligible for meals based on the criteria in that informational letter. So again, it has to be due to the COVID-19 related issues. You have to self-isolate, you don't have access to your normal services, those types of things, and be at risk. Yep. So take a look at that IL and hopefully it'll answer your questions.
We have another question. What's the length of time a provider may request for a retainer payment?
So again, we have a call with CMS this afternoon. We have sent them our proposal for payments, and so the expectation is that the provider will identify a single 30-day period of time, could be the month of April, could be the month of May, in which they have experienced revenue loss tied to a specific member. But the requirement in the emergency disaster waiver request to CMS is that it's for no more than 30 days, and it has to be related to a specific member. So I would have served this member for 23 days in DayHab during the month of April. I'm asking for 23 units of T2020 for this member for this 30-day period. And the 30-day period is going to be a distinct period that covers the entire provider organization chosen by that provider, but it's for the entire request. So the provider will have to tell us which period that they're asking for the retainer payment. The provider will also have to provide us with a member roster to go along with the request for retainer payment form, so that we have those individuals identified. We're going to do a verification on the back end that payments were paid appropriately.
Leanne, Lynn just wants to clarify, providers can ask for each of the members for whom they lost revenue, correct?
Correct. For each member for whom they've lost revenue, either due to the service line being closed altogether or due to a reduction of hours. The member has to self-isolate because of COVID and can't come. Whatever reason related to COVID, the provider may ask for a retainer payment for each identified member. That's why we're asking for the roster. But it's only for a specified 30 period of time. So you can't ask for a 30-day period of time for Mary in April and ask for a 30-day period of time for Joe in May. It has to be one 30-day period of time identified by the provider.
And would that also include all services the person may have been in for that time?
No, only the identified day services. So what we've identified, and they had to be services that had a component of personal care to it. So we've identified pre-vocational services, adult daycare, day habilitation, and did I say supported employment? Supported employment, and I want to say consumer-directed attendant care. Let me double check on that. I just got the updated documents this morning. Let me confirm that real quick. Sorry. Let's see here. Here we go. So here's the draft. Okay. Yes. So it will be for adult daycare, consumer-directed attendant care, pre-vocational services, supported employment, and day habilitation. And so that will be across, so those, the AIDS HIV waiver, of course, adult daycare, consumer-directed attendant care, PD waiver is CDAC, ID waiver would be adult daycare, consumer-directed attendant care, day hab, pre-voc, and supported employment. And then the BI waiver, of course, is adult daycare, CDAC, pre-voc, supported employment. State plan, HCBS, day hab, pre-voc, and supported employment. Those are the services that are being targeted for retainer payments.
Great. Thank you so much, Leanne. Does anybody else have any other questions for Leanne? I want to thank Leanne and all the folks at Medicaid that I know have been working really, really hard to try to be really responsive to addressing sort of our current needs in this odd time. So thank you so much. And thanks, Leanne, for all the great information.
You're welcome. And for the sake of time, I will not go over the employment data. Y'all can see that for yourself. I'm sure Amy will make it available to everybody. But the one thing I did want to let folks know is that we're not going to have April employment data this year. We've determined that because of all the weirdness that's going on with employment and services and just the challenge right now for everybody, we're not going to collect employment data in April. We're instead going to collect it for the last 2 weeks of July this summer. That's presuming we're back to somewhat quasi-typical employment status for folks. Again, we may get to July and say, oh, it's not going to be worth it, it's not good, but and push it off till October and just skip the second period reporting and just go into our October data. But I really would like to see something in July, because I think it'll be telling for us as to what the impact has been of COVID as well. So I think it could be informative for us going forward. So I'm looking forward to getting that, having that collected in July, but I'm not making promises that that won't change if we're still in a similar situation come July.
Great. Thank you, Leanne. For anybody who's asked, we're happy to email the documents. If you need them, just put in the chat box that you need us to email them to you. Also, if you scroll to the top of the chat box is a link that has all the documents in a share drive that you can access as well. So if you're not able to access that, let us know and we'll be sure to send those out following our meeting today. I know that we had questions, just some MCO questions that had come in. I know, Leanne, you addressed some of those in your overview. I think we have Denise Jewell and Shauna on, who were going to be available if folks had any specific questions for the managed care organizations right now. So does anybody have anything that they'd like to ask our MCO partners? You can either type it in the chat box or you can unmute your phone and or computer and just ask directly as well. Laura wanted to know, and this might be for Leanne, it could be for the MCOs as well. Is there a specific link to the meal information that people can access?
You're talking about how to request meals?
I believe that that's...
It's in that informational letter. So if they open that resource document that I sent today, the update document, they'll find a link to the informational letter that addresses the meals. And yep. Oh. Yep. So if you scroll down through that document, keep going. Okay, so there, IL 2127. Went too far.
Did I go too? Thanks. I'm sorry. I'm going IL 20. Keep going up.
Yep. It's
Sorry,
on the
guys.
first page at the bottom.
Okay.
It's IL 2127.
Right.
If you click on that link, yep, click on that link.
Leanne, is that where the telehealth informational letter is too? Is that 2115 or a different one?
Yes, yep, the 2115 and 2119, as well. You talk about billing for telehealth. The 2126 is probably the most current. We keep, adding a little bit. So I would look at 2126 first, and it probably links you back to the other two for telehealth.
Okay, thank you. I had a couple people asking for that one specifically, so that's where it's at.
Absolutely.
Thank you.
And there's quite a bit of information in that provider toolkit about telehealth, some very specific questions about rendering telehealth. So be sure and check that out.
And Leanne had mentioned earlier too that they're updating that almost daily. So you'll want to go back. Here's the toolkit. My hyperlinks are not working very quickly, so so that you'll all get this, and it's in that shared in the document that we linked earlier.
I do have a question.
Oh, go ahead, please.
This is Kim Kellner, and I have a question for Leanne. This was the first that we were hearing about the services properly being authorized for the employment. How is it that we're going to be able to go back into April? Because we are right now in the midst of billing for all of April for our supported employment for those few individuals that's been working, of course, at a lower tier, to get those adjustments made through the case managers.
Yep.
How can we get that?
So the MCOs should be communicating that information out to their provider networks about their expectations around authorization changes. The department has been, trying to keep everybody apprised through the FAQ and provider toolkit. So that's how we're communicating about all of these changes related to COVID right now. And again, the services should always be appropriate to what's authorized.
Was there a specific link to the retainer information, Leanne? Did you already answer that?
No, the retainer information is not published yet. We have a call this afternoon with CMS. We're working to finalize our processes. We need to get their kind of blessing in order to move forward with getting the informational letter out and the provider request form out to everyone. So as soon as we get leadership approval and CMS's blessing on our processes, then we will go forward. We had to provide cost information to CMS as to what's this going to cost. On the low end, we were looking at like 3.3 million. On the high end, we were looking at like 12 million. You know, and where are those dollars coming from? We are getting additional FMAP for COVID during a certain period of time this year. But the governor has made it clear she wants to provide this aid to providers, and we are going full speed ahead in order to do what we got to do to try and make that happen. But as soon as we get the blessing and the green light, we'll get that informational letter published out there. If you don't currently subscribe to the informational letter bulletins, you can go to that info letter link that I provided in that resource document and subscribe, and you can subscribe to specific information that you want. If you just want information related to HCBS, you can request that. If you want specific information just related to your provider type, you can request that. So it's really up to you to determine what kind of notifications you get through the subscription service.
Great, thanks, Leanne. I don't see any questions that have popped up right now, Denise, for you and Shauna. So we can come back to that if people have questions, but thank you for making yourself available.
Sure.
I think this is the first time I've ever uttered the words, I don't believe there's any questions for the MCO. Okay, so I think we're going to go ahead and move on. Vienna, would you like to give any kind of updates from IVRS? And I also shared in that document the resources, the autism resources that you sent me.
Great. Well, I am super glad that Leanne went right before me, because she basically covered a lot of the things and the processes that we've chosen to do. Voc Rehab from the get-go has encouraged our staff to not close any cases and to work real closely with all of our folks in determining, you know, what adjustments need to be made due to COVID-19. Taking a look at the authorized activities, and very similar to what Leanne had said about her group, is just to take a look at, you know, what authorized activities the job candidates truly needs at this time, and making that reflective of what is happening out there. And then, you know, when all of this smoke lifts, we can take a look at those authorizations and reauthorize things that need to be done. We've encouraged folks to continue as much as possible and be creative in a virtual platform. We've continued everything from the pre-voc employment readiness activities to the post-employment employment maintenance type activities. So just really trying to be as creative and encouraging folks to be as creative as possible to do what we can to support the job candidates that we work with in the various stages that they are in. We're still working with our older workers, employment specialists, in working with folks who are 55 and older. And the awesome thing about our OWEB workers is that they have the connections with their area agencies, and so they're able to provide a lot of things that are impacting their ability to continue their journey on that employment process. And so, you know, things such as being able to provide meals and resources and so forth. They're doing tremendous work in terms of even doing peer counseling type of activities. I thought I saw Rima on the call as well, and they've been reporting on beautiful activities that they're doing in terms of advocacy and taking a look at things that are going on, not just with things that's happening right now, you know, with the PPE type needs, but also what legislators are going to be faced with and how those decisions are going to impact future things for independent living needs. So they're doing some wonderful things in that route. We've got our transition folks who are still maintaining full force efforts towards providing for the transitioning folks. And we have Mary Jackson on the line who can talk to you about the things that we're doing towards that front. And just lots of things that we're doing that we thought that we couldn't do because we've gone on we've been challenged to rise to the occasion, and it's just really neat to see people be really inventive. And the interesting things that we've discovered through this whole process is that we're actually getting direct communication through these virtual platforms more than we were able to with a lot of our transitioning students and so forth, as well as some of our collaborative agencies and so forth. And so it's kind of interesting to see that happen. I'm pretty sure a lot of folks are experiencing the abundance of emails that we're getting that we never experienced before. And so, you know, communication is so important, and we think in forms of, you know, picking up a phone and hearing a voice and so forth, but it's happening on a different platform. But because of that, maybe because we're trying to learn this new platform and new ways of connecting, we're getting more, and through that process, we're communicating more on not just more, but on a deeper level in terms of the details that we're able to get and provide and so forth. So that's really neat to see from all these experiences. But that's really what I have to inform. I'm going to leave the details to what we're doing in transition with Mary, and if Rima wants to talk a little bit more about the details of what they're doing in independent living, as far as, you know, the information referrals that they are doing, which is tons of information and referral for all the resources that are available out there. The peer counseling and the hotlines that they have are, I believe that they've got set up and up and running, and the advocacy work that they're doing legislative wise and so forth. So.
Okay. And I'll just add to what Vienna said. Like she said, I'm Mary Jackson. I'm the Transition Resource Manager with VR. Just to piggyback, we spent a lot of time with our staff, especially our transition staff, and training on utilizing virtual platforms like Google, Zoom, appropriate settings to have with students, especially for recording activities and various things like that. But it really is, I would say, services as usual, but in a different platform, if that makes sense. So we're still connecting with students. We're still providing pre-ETS activities. We have a lot of creative staff out there across the field, and actually some have really thrived in this new environment that we are reaching students in. We did want to make everyone aware of this summer. We actually are going to be doing a virtual Prix summer program, and it's going to be June 15th through July 30th. And it will be a Me Monday, a Transition Tuesday, a Working Wednesday, and a Tour Thursday. And I have something, Amy, I saw you just trying to write some of that stuff down. I have a flyer I can send to you that has this information on it.
Perfect.
So what it's going to be, it's actually going to be statewide virtual pre-ETS activities that are going to be held for students across the state. And every area office, they're collaborating to provide these each of the 4 days for those 7-week period. And the reason that we're doing this is trying to touch base with more students. We know not everybody has access to technology right now, so we are formulating other ways to connect with some of those students, like choice boards, where we can mail things to them and then follow up and do activities by phone. But right now, everything this summer, I know we don't know exactly what the summer is going to look like in terms of COVID-19, but we have already made the decision that everything will be virtual for all of our summer programming for our transition students. We don't want to be bringing in the groups of students at this point, and so we did have to make that decision early in order to start planning for it. So I do have a save the date flyer that I can send out to you, Amy, if you want to share that with the group that has this information. All of our activities will be posted on our website. Also, local area offices are continuing to develop localized activities as well. And again, those will all be held virtual too. And they'll focus in on, we've got lots of employers that are willing to do virtual tours with us, a lot of creative things that they're doing. And these are activities we've wanted to do for years. And it's just interesting that it kind of takes the pandemic to get people out of their comfort zone of always having to do things in person and be able to do things virtually. We've had a difficult time in the past in some of our rural communities with getting them exposed to different activities or different opportunities across the state. And so we're trying this out this summer to try and get some of those students connected. For those of you that are interested in deaf and hard of hearing services, we are also going to have Prix activities designed once a week as well, all summer long, that are going to be just for the deaf and hard of hearing population. That's really going to focus in on some of their transition needs and going over some of the topic content areas that some of our deaf and hard of hearing ER counselors across the state have deemed as maybe something that would be really important for those students transitioning out of high school to know as well.
I just wanted to add real quickly, it's really cool because, you know, some of the industries and businesses that have concerns such as safety and so forth for folks who do tours and have not been able to traditionally do so are now able to do so through a virtual platform because that safety component has been addressed through, you know, by the virtual platform. And so it's kind of neat how, you know, such things as that is as a result of this, but it's something that's gonna enable us to have more of a tool to be able to expand into a lot of different areas to be able to do things with folks so that we're not concerned with safety or confidentiality and those types of things.
That's great. Thank you so much, Vienna and Mary. I know that we also have Susie, who's made herself available. We've gotten some questions that are really related to benefits and some of the earlier discussion too with some of the stimulus payments or some of the different things and how that might affect folks' benefits. And I see that Misty's on as well. So we have a couple of great benefits experts. So excuse me, I'd like to just open it up. Does anybody have any questions related to benefits counseling right now?
Can I just say really quickly something that Voc Rehab has started, and it's all because of Susie. She's been so tremendous in kind of pioneering some activities that we're doing to kind of oh, how do I say this? You know, you don't know what to ask if you don't know anything about it, and that's something that Susie kind of taught us when we expect folks to ask questions about what their benefits is like and how planning to go back to work and so forth, how is it going to impact them? They don't know the questions to ask, and so having someone like Susie and and doing a lot of the different things. And Susie, I hope that you'll talk about, you know, like your family night things and all of the different trainings and all of the different groups that you've started and how that has kind of spearheaded folks towards thinking about, you know, these are things that you should be thinking about versus asking them to come up with the questions and so forth. So I thought that was kind of really neat, and that's something that has come out of Susie's great world of imagination. So.
That's a great way to put it, right? So we created two parent nights. Parent engagement is what Dave likes to call them. The first one was last Wednesday with parents that have students that are deaf or hard of hearing, and we had 7 families show up. And then Thursday night was also parent engagement, and that one had 61 families that showed up. And basically, I got email addresses so that we could send out a survey Friday, and I'm starting to get results in of the interest level and the things that people have questions for. And some of them actually said exactly what Vienna shared with, they don't even know what questions to ask. They just know there's something they're supposed to do, but they're struggling with what to ask. So I'm Susie Paulson. I am the Benefits Planning Resource Manager at Iowa Vocational Rehabilitation. And I guess I want to say happy Cinco de Mayo. And also, if you're working with individuals who are non-filers for IRS, they aren't required to file. Today is the last day that they can go in and put their information in about their dependent children that are under age 17. Definitely, today is the day, and I'll put a couple of links in there. Throughout this whole thing, I've had a lot of people send me, Disability Scoop or what CSAVR says or all these other agencies. And I always think it's best to go to what the IRS says and what Social Security says. That's where you're going to get the best information. So I'll put those 2 in there. So that's really important for individuals that are on SSI or SSDI that are non-filing for the last 2 years, to make sure that they go into that site and put their information in there if they have students that are under the age of 17. There's also a lot of individuals that need to go online and put their banking information in for Social Security. It's called Get My Payment Info, and you can just put it in, and it's really slick, works really quickly. That would include people who have had to pay taxes for the last couple of years. They might want to go in there and put their banking information. Otherwise, in their case, Social Security will just mail them the check, but that might not be till August. So it kind of depends on how urgently the person wants to get it. I don't want to go into too many details because I know you have a lot of other people on the agenda today. But there is a huge group of individuals who are completely overlooked in all of this. And I thought I should talk about that and make sure that people know that that's what is happening. So there are individuals that are over the age of 17, and they're still claimed as a dependent on their parents or somebody else's. Claimed as the dependent, and those individuals are not going to receive a stimulus check, nor can their parents get that extra $500. So I don't know if that people were aware of it. I talked to a couple of people at Social Security. They're now aware of it, but I don't know if that's going to change. I've heard that there may be another stimulus package that addresses it, because if you think about it, that's every college student pretty much that's still claimed as a dependent. So other things, I think Leanne covered a lot of that. So if you have any questions, or Misty, if I left anything out, please feel free to jump in.
I don't think you missed anything. I think Leanne touched on the most important thing, is that the folks that we're working with know that that stimulus money does not count against those needs-based programs for the 12 months. That's probably one of the most common questions that Tammy and I have been receiving, is, does that money count? How does unemployment count? Those kind of questions. So I think that covered it all. Yeah.
Thanks, Misty.
Thank you so much, Susie and Misty. I have an IVRS question that came in. Is IVRS reassessing their computer purchasing policy for job candidates, since computers allow them to participate in VR activities more than ever now? I'd be interested in seeing data in this area. Vienna, you're muted.
Sorry, I forgot.
No worries.
We haven't really changed anything as far as the policies for computer purchasing is concerned, but I think that some offices are taking a look at the need, especially for our college students, when the colleges went onto the online learning platforms and so forth. So
Thanks, Vienna. I think then we'll go ahead and we'll move on. Rema, I think that Vienna gave an incredible shout out to some of the work that you guys are doing. I saw that Laura's on as well. And so what I had asked Rema if she would represent the independent living centers and talk a little bit about some of the resources and services. And I know there's some additional funding that's been channeled to the independent living centers as well as the aging and disability centers. So I asked Rema, and Kyra will go after Rema to tell us a little bit about how those resources, how people, what's available, how people might access it, what's some things out there to support Iowans right now. So I'm going to turn it over to you, Rema.
Thank you, Amy, and hi, everybody. My name's Rema McCoy McDeed. I'm the Executive Director of Central Iowa Center for Independent Living. Shout out to all of us on the call today who have small children that are running around us. I can assure you that I'm wearing pants. My daughter is not. And so if I switch over to the CISL logo, it's because she has run into the room and she is not dressed appropriately for this meeting. Anyhow, thank you, Vienna, for getting the conversation going about what's going on at Centers for Independent Living. Much appreciated. And I will talk about that, but first things first, I want to talk about the CARES Act funding that Centers for Independent Living across the country, including CISL, have received as a result of the wonderful advocacy that the National Council on Independent Living did as Package 3 was being discussed at the federal legislative level. And so because of the CARES Act, Centers for Independent Living across the country received about $85 million. And the purpose of the money is to provide services to disabled people in our service area who have been impacted by COVID-19. Now, obviously, COVID-19 has impacted everybody. And so there really isn't anybody that we touch at CISL that has not been impacted by COVID-19. And so the funding has been dispersed to Centers for Independent Living, and it is meant to be used by September 30th of 2021. And so there are 6 Centers for Independent Living in Iowa, in all the major metropolitan areas almost, with the exception of Waterloo, unfortunately, and Dubuque. And CISL has received, as a result of the CARES Act, $221,000 that we are meant to exhaust by next September. And so the way that Centers for Independent Living operate is very simple. Everything that we do is directed by the individuals that we serve. And so when we became notified of this funding, our guiding force as far as conversations regarding how we are going to use those funds is very much focused on what the people that we work with have a need for right now, and also what the people that we could potentially work with, what their needs are. And so those needs are very specific to a few certain areas. Now, CISL is one of the 2 Centers for Independent Living that provide supported employment services in Iowa. Access to Independence, which serves the Iowa City, Cedar Rapids area, is the other one. And so obviously this funding, one of the focus points for this funding at CISL is going to be supported employment. And so obviously supported employment has been very much impacted by COVID-19. And we have seen this as an opportunity to really explore bringing supported employment, at least how we do it at CISL, in a very 21st century manner. And prior to the pandemic, we had begun conversation. Heck, Laura and I and Brana worked at Candeo prior to working at CISL, and that was several years ago, and we were in conversation about how to provide services in a manner that makes use of the technology that's currently available and that could be available. And so providing job coaching in particular in a remote capacity has been something that's been on our minds for a long, long time. COVID-19 has presented us with a very immediate, urgent, and acute opportunity to explore what that could look like as far as CISL clients are concerned. And so that is something that we're looking very closely at. And so CISL staff are in conversation currently with Tracy Kenninger at Easter Seals with regards to what we need to do to make that happen and how Easter Seals can be a support, particularly their assistive technology department. And so what we anticipate that looking like is connecting individuals that we are serving who are participating in job coaching services in particular with tablets, smartphones, etc., that they are going to be able to use at their job sites so that we can serve them without actually physically being there. And for all of us who are on the call, I know that this is a potential, this is an opportunity to really address a barrier that many of us experience when we're providing job coaching services. Many of the individuals that we work with prior to the pandemic work at job sites where it's very difficult for a job coach to physically be present. And so if we can address this barrier to support at this time and successfully provide job coaching services to individuals remotely, that's not only great news for CISL, but it's great news for supported employment on the whole. So that's one area. Supported employment is not the only thing that CISL does. We are federally mandated to provide what are known as the 5 core services, and supported employment falls under the core service of transition. So transitioning not only students who are graduating from high school into the world of work, but transitioning people who have been unemployed for either long periods of time or have never experienced employment into the world of work. So that's where supported employment fits as far as the puzzle pieces of CISL. We also provide information and referral services, independent living skills training, peer support, and individual and systems advocacy. And so that COVID-19 funding that we have will also be utilized in those other 4 core services as well. And I'm happy to answer questions about what we're thinking as far as those services and that funding are concerned. You're very welcome to send me an email. You can also send Laura an email. She's on the Zoom call right now, smiling, and looks like she's at the CISL office right now. And our email address is our first name @CISL.org. I'm also going to send momentarily an FAQ sheet that our federal funder has sent out that outlines the parameters for this CARES Act COVID-19 funding, just in case anybody has any questions about what Centers for Independent Living can and cannot do with that funding. And like I mentioned originally, each center operates based on what the individuals we serve have a need for. And so what I'm talking about as far as possibly happening at CISL might not necessarily happen at the other centers, because the other centers are focused on providing services based on their specific clients' needs. And so the way that this money gets utilized is going to look very different at other centers. And so I encourage everybody on the Zoom call right now to reach out to your local Center for Independent Living if you have specific questions about what they anticipate using their specific funding for. And so with that, there's also on the immediate horizon a potential partnership opportunity between Centene in Iowa is obviously known as Iowa Total Care, and Centers for Independent Living across the country. And I'm going to send a press release that Centene put out regarding that partnership opportunity here in a moment. But Centene is wanting to connect with Centers for Independent Living and assist us in not utilizing our COVID-19 funding necessarily, but in really connecting with disabled people in our service area in a way that's positively impactful and very specific to COVID-19. And so that could play a role depending on the Center for Independent Living in particular, as far as how their funding gets directed. So I'll send both of those links out momentarily. And then, Amy, I want to be mindful of time. I'm very happy to speak further about what's happening at CISL outside of that funding. Deanna mentioned our hotline and a few other things, but I will only do so with your blessing.
Yeah, I think that's fine, Rima. Go ahead.
Okay, so the COVID-19 pandemic has certainly impacted human services providers everywhere in very different ways. And so we are no exception to that. March 16th, we switched gears at CISL and shifted from providing services in person to providing services remotely. And that shift was very quick and not necessarily methodical. And so a lot of planning happened after the fact. And so as we've grappled with how to provide the 5 core services in a remote capacity, it's presented us with opportunities to get really creative about how we do that. And so one of the things that we rolled out a few weeks ago was a COVID-19 hotline specifically for disabled people in central Iowa. That number is 866-44-CISL, CICIL. And that number is staffed with CISL staff between the hours of 8 and 5, Monday through Friday. And it's a number that a person can call if they have questions, comments, concerns about services that are available to them in their area, questions specific to COVID-19. And it's also a means for us to provide peer support to people who are simply looking for somebody to talk to. Isolation has very obviously become an issue during the pandemic. People who are able to socially isolate, that's a wonderful privilege, but at the same time, so with that privilege of social isolation comes the reality of loneliness that comes with that. And so people are also able to use that hotline to contact us if they're just looking for peer support. There's also a national hotline, and I can post a link to that for a COVID-19 specific to the disability community phone number, and we actually forward our hotline to that number after hours. And so that allows for people to have a 24/7 resource and listening ear. So there's that. We also had the opportunity to deliver hundreds of care packages in our service area to disabled people, both those that are our clients and also people who are prospective clients. Care packages included food, toilet paper, hand sanitizer, toothpaste, antibacterial soap, et cetera, et cetera. That was a great success, and we're actually on the verge of doing another round of care packages, and the second round is going to have face masks that volunteers have sewn on behalf of CISL. So we're looking forward to doing that as well. And we're just moving full steam ahead as far as bringing CISL fully into the virtual realm. We are looking into recording videos that are specific to independent living skills training on benefits planning, on financial management, on various other topics. And once we get those videos closed captioned and add audio descriptions to them, we will be putting those out into social media and on our website, and various other things. One thing that we have, well, at least I certainly have encountered during the pandemic is the fact that many people that we serve and that we could potentially serve are actually pretty okay with the virtual services. Some folks actually prefer it to working with us in person. There are definitely a lot of benefits to not having to physically be in contact with folks, particularly for those of us who experience neurodiversity or anxiety at the prospect of somebody coming to our house. Us being able to go into a person's house via phone or via Skype or Zoom feels a lot less, it puts a lot less pressure on some of the folks that we are working with. And so we definitely appreciate learning that lesson and getting really specific, being able to very specifically address the services that people are requesting from us and being able to provide them in a way that works for them, whether that's in person or virtually. And so we see this pandemic as an opportunity to take the next step as far as choice is concerned. Not only are people who we're working with choosing what services they participate in, they're also choosing how those services are delivered to them. And so we appreciate being able to explore that opportunity, especially now that we have this gift of funding, especially given the unfortunate fact that many of our sister providers are experiencing the opposite, a loss of funding and the sad reality of having to furlough staff at this time. And so we want to make sure that everything that we're doing, especially with regards to the COVID-19 funding, is as positively impactful, not only for CISL clients, but just for the disability community in the state of Iowa as possible. So that's all I got, and happy to answer any questions either here or by email.
Rayma and Laura, that is incredible. Thank you so much for all the work that you're doing, all that support. I know that you guys don't have a ton of staff, and you guys are really doing a number of amazing things, and I personally really appreciate it, and it's really impressive. So thank you for the work, and thank you for the update. Any other questions that folks might have or comments?
I just want to do a shout out to Iowa APSI. They donated 150 reusable grocery bags for our care packages. So that was really awesome.
Thanks, Laura. I saw a picture, I think on Facebook, of all the bags, and it was pretty impressive. Thank you. All right. Thank you. I'm going to move to Kyra to give us an update on the Aging and Disability Resources. Oh, Kyra, I think you're muted.
Can you guys hear me okay? Okay, great. I might freeze because of our internet connection, but bear with me. Hopefully it will last and I'll try to be pretty brief. Okay, so I tossed in a few pieces of information into our chat box. There's some socialization resources, some information on caregivers, long-term care facilities, and just some other resources on our website. So I just tossed that in the chat if anybody needs those. I might, is it okay if I share my screen with you guys?
Yeah, absolutely.
So right now, the AAAs are providing a lot of the services. So I went ahead and sent over a copy of what the map looks like, but I thought I would just start with that so you could see there are 6 AAAs for Iowa, and there's information on the bottom for the contact information for each of the AAAs. So Amy will be able to send that out to you guys. But the AAAs are providing the bulk of the services that we are providing to folks right now. So this is what services typically look like for the AAAs. I wanted to bring it up here just so you could see visually what it looks like. So we kind of have 3 buckets of services, some mandatory services for information services and assistance, nutrition and health promotion, and then we have a lot of optional services that fall into that last bucket. And so as things have changed with COVID-19, we have changed kind of what things look like. Can you guys see what I'm looking at? No, okay. Give me just a second. There we go. So hopefully, can you see it now?
Yes.
So this is what the Older Americans Act services look like. So it's 3 buckets of services, and then under each, you can kind of see what they are and kind of what the service looks like. The AAAs provide a lot of services, but right now the focus really has been on those health activities, nutrition, socialization, caregiving services to make sure people have what they need at home. And so as we have moved our services out of traditional service delivery, we've seen just some changes from what people have been doing. For nutrition, they've really worked hard on the different services here. I'll take you to, I sent this brochure to Amy, but as you can see, there's the Older Americans Act, which is anyone 60 and older, and then individuals with disabilities that are 18 to 59. So really, anybody that we're touching is going to be in those demographics, but part of this is also some of the school nutrition aspects, WIC, and working with folks who are struggling with access to food. So I wanted to talk about the CARES Act, the Families First Act, and the ADRC Grant. So all of them, as has been mentioned previously, currently those funds all expire September 30th, 2021. So I wanted to start with Families First Act because that one really is the first one that came down. So that was $2.3 million was the amount, and that was for folks who are 60 and older. That was for home delivered meals and that congregate nutrition, and that was really focused on those 2 services. So then the CARES Act came down. The amount was $6.9 million, and that time frame is April 1st to, again, that September 30th. And that one was for 60 and older caregivers, individuals 18 plus living with a disability. And so these services really fall into 3 categories.
Kyra, I think you might have froze. So I last heard you were.
Homemaker, material aid, and personal care were what those services were prioritized for. And then the ADRC grant was the third piece, and that was $450,000. And that one is for May 1st till September 30th. And that was for folks 18 to 59 living with a disability, and those who are 60 and older with no other funding supports. So those were for the services that were focused on for that were care transition, social isolation interventions, meals, transportation, and assistive devices. And so that's kind of the three parts of funding that came down. And then the Older Americans Act funding and elderly services were what I was talking about before. And that's a combination of some federal dollars, state dollars, and ADRC and Lifelong Links funding. And that's an annual fund, but I just wanted to cover those. I know it's kind of confusing, but if you look at it over time, they've slowly trickled down money to each of those three buckets. That's kind of how I look at it, and that kind of makes it easier to understand. As we look to move forward, we've seen really amazing things from the AAAs doing sites and boxes and having drive-throughs during the week for people. Lots of different activities. We had one AAA get funding for pet food assistance that they've been sharing between them. So I'm really just finding some creative ways to help support this population of folks and get more people served. I feel like every time I talk with the team, it's, yeah, we're pushing out a lot of meals and services and really helping spend down like that money that they've been given from the federal government. So it's been great to see the communities and people reaching out for need. And I would just encourage you, if you haven't connected with your area agency on aging, to make sure that you're giving them a call and directing folks that way if they have questions or need services, because I know that it can be a difficult time. And there's also, I can send the flyer to you guys as well for Lifelong Links, which is a great resource for people to call. I know that like 211 and all the information lines are being flooded and people are having to wait a really long time to get their questions answered, but this hotline is specifically for our folks 16 older, and those living with disabilities are 18 to 59. So I can send that over as well. I was trying to think if I hit all my.
I think you might have froze again, Kyra.
Familiar, but hopefully that gives you a brief overview of what I help with over at the Department on Aging.
Thank you so much. That was really helpful. Are there any specific questions folks might have for Kyra?
If I could jump in. Sorry, this is Rima, and I failed to mention this, but CISL and hopefully the other Centers for Dependent Living are reaching out to ADRC with the hope of collaborating with regards to providing services to disabled people during COVID-19, with utilizing some of the funding that we've all received specific to COVID-19, with the hopes of not duplicating services in our service area. So again, keeping in mind the hope to be as economical and effective with our COVID-19 funding. So hopefully Kyra or myself or both of us will have an update at our next ICIE meeting as far as what that's gonna look like.
Excellent, thank you. Other questions that folks might have or comments? We'll capture the resources that folks are putting in the chat box and make sure those are included in the things that we share with everybody. Thank you so much. Paige, would you like to talk about some of the, give us an update from the Iowa Department of Human Rights? And you shared some different resources as well that we thought maybe individuals and families might be able to utilize.
Yep, there's some links in the document that Amy put together. The Department of Human Rights provides administrative oversight to Iowa's 17 community action agencies, and those local agencies provide critical services to people with disabilities and low-income families and the elderly. And they've also received additional funding through the CARES Act. And so one thing in particular that I wanted to mention is the Low-Income Home Energy Assistance Program, or LIHEAP. That application deadline has been extended for families that need assistance with their utility bills. It's been extended to May 31st. And so they can apply for assistance for that through their local community action agency. Even if people weren't previously eligible, if they've had a reduction in hours or income, or they've been laid off, they're encouraged to apply because there's a lot of additional funding available to help people with their utility bills. And so they can do that through their local community action agency. And then just another reminder that you know, it's kind of similar to what Rima described. You know, the money comes down from the federal government, and then each local agency can kind of use it how they need it in their communities. And the same thing goes for the Community Services Block Grant that comes down from the federal level through the Department of Human Rights. And Iowa is receiving $10 million for additional CSBG funding, and that goes out to those local community action agencies, and they determine based on the needs in their community how that gets used. And so just a good reminder for local providers and other state partners to connect with the community action agencies. And then you know, just I think sometimes in the disability world we forget that that's a resource, but it is out there, and they do have some funding during a time when a lot of things are being cut. Other than that, our department is, you know, we have things like weatherization and community advocacy and services, which are really focused on helping underserved populations understand COVID-19 and access really critical resources. That includes, you know, getting a lot of information to our essential workers. So they're busy doing a lot of language translation and making sure that people have access to that information. Other than that, I don't really have anything. I mean, if there's questions, I'm happy to answer them. Otherwise, the resources Amy's pulling up here. This is a flow chart. Anybody who knows me knows I love a flow chart. And this kind of walks people through like unemployment insurance benefits and leave, and you know, just kind of that process that people take when they're trying to figure out you know, how when they're impacted by COVID-19 what they might be eligible for. So that's something you can share. And then I think I sent some information on the economic impact payment. So the population that I work primarily with includes people with disabilities, but it's a little bit broader, and it includes low-income families receiving FIP, or Iowa's cash assistance. And so the FAQ has information about you know, what should low-income families who are non-filers do. But as Susie mentioned today, it's the last day to go in and do that. So I'm not sure if it will be that relevant after this, but there's some good information on there.
Great, thank you so much, Paige. Does anybody have any questions or comments for Paige? one of the things that we thought was important was where we knew there might be resources to just help broad populations of people right now. So we were hoping that if you weren't familiar with some of these things, that you would be able to then take some of this information and share it with the individuals you serve and their families if it's of benefit to certain folks. So thank you so much, Paige. Brooke, would you mind giving us a DD Council update? And I know you were going to share a little bit about policy and advocacy opportunities, and I believe you have a new staff that you'd like to introduce to us.
I do. He was on here earlier but had to pop off at 11:30. But we did hire a new public policy manager. It's Bill Kalstead. He actually used my link to sign in today, so there's actually 2 Brooke Lovelaces and one didn't look like me. So if you were confused about that, that's why. I think he has popped off, but we're fortunate to have him. He's from LSI, and I think he's going to bring some good provider experience to the council as well as some advocacy. So feel free to introduce yourself to him and send him an email, say hi. And he may actually, when we ever do get to come back together for an ICIE meeting, he'll probably come to the first couple ones just to find out a little bit about what we do. There's really, as a policy level on the state level, I'm sure a lot of folks know this, there's really not a lot going on because they suspended the session up through now until 10 o'clock on May 15th. I think we'll find out this week whether or not they're going to extend it through June or through the end of May, which is really the rumor out there is that they won't start back up till to June 1st. And then when they do start back up, they had a meeting last week to talk about it. It is not going to. They had about 5 more weeks of session to do. They are looking at trying to finish up within just a day or 2. So we're talking hours that they're going to reconvene, not just days or even a week. The primary thing that they're going to be working on is going to be the budget and any COVID-19 packages that they might consider. There's nothing that I've seen so far on that. The governor is supposed to, I believe, I didn't get to listen to her press conference today, but I believe that her budget's supposed to be released still this week. We do, or an updated budget, I should say. We do know that she's going to take out the Invest Iowa legislation that was in there that increased the sales tax. So that will not be a part of the updated budget. So we'll be, and I'll post our Infonet link. We did have an issue of Infonet that hit last week that had some of this information in it, and so I just posted that as a resource too. But when we do hear of her budget and coming out, do look for Infonet. That we'll have something updated on our website that will give an overview of what those changes are. And what to expect. I think what we're hearing is there's a 48% decrease in sales tax, but they say they're not concerned about that because of that supplemental funding that they have, or surplus funding that they have to help cover that 48%. But that does seem to be like it's quite a big hit that the state will be facing. A couple of other things. That's really it for the federal level, but Infonet. We'll be getting stuff out for you guys when we hear that more on the state level. But I do want to encourage folks. You should have received now, and if you are supporting people with disabilities and they're registered to vote, they should have received their request for an absentee ballot form. Those hit the mail last week, I believe, and so. Anybody that was a registered voter, the Secretary of State's office did send out an absentee request form that you have to fill out if you are wanting to vote from home this primary, which is June 2nd. And the Secretary of State, as well as the DD Council on Infonet and Iowans with Disabilities in Action, are really pushing that people do consider requesting that absentee ballot and stay safe and vote from home. I know you guys are used to Iowa's Disabilities in Action saying, get out and vote, get out and vote. Now we're saying, stay home and vote, stay home and vote. So if you do support folks with disabilities, don't throw that piece of mail away. Help them fill that out. They can also, if they're not registered to vote, they can also obviously request an absentee ballot from their county auditor's office. Again, all that information is in our Infonet, our last issue that we did. The request for the absentee ballot to vote absentee is May 22nd. And then to get your absentee vote ballot in is June 1st, I want to say. Let me just make sure I'm telling you that right. June 1st, Monday, June 1st is when it must be received by the post office for that vote to count. So we also have some information about who's retiring from the state level that's in that newsletter. So you can check that out to see how to find out information about who's running in your district. The other thing, just to throw a plug out in there, is that the census is still out there, and maybe encourage people to take part in the census and encourage the folks that they support to take part in the census, because it does help determine what funding each of our rural areas is going to be receiving. So I think that's extended through August. So since people are staying at home, they should definitely be able to fill out that census. It only takes about 10 minutes to do. There are, on the federal level, there is there's still an opportunity to do some advocacy on the federal level. There's this, I guess it's the fourth coronavirus package that's out there that I think the representatives are talking about this week. And so if there are needs that folks still have, I would encourage you to contact your state representatives and discuss those needs, because they are debating that package as we speak. And so there is some advocacy that way to do. Going back to the state level, I should mention is that they're really only going to be working on the budget. So any of the previous legislation that even made it through funnel, we think is pretty much going to be a dead deal. That they're not going to be putting anything through besides a budget. And then if there's any emergency relief funds, they should do. So I know the council was following a couple of legislation, one that was about the changing tables having the adult changing tables in the rest areas. Looks like that will, that's one that's going to probably die more than likely. And then the other one that we talked about, I think at the last IC meeting, was that there was legislation out there that was making it still legal to discriminate against somebody with disability on whether or not they were able to receive donors. So that's still something that will be an issue. Both those things will be something that will need to be re-sponsored next year, because there'll be a whole new legislative session. And so I know I'm running out of time here, but that's one other thing, is to remember that, we're going to be going through an election period here since we're voting in the primary. And so it is important to get out there and meet who you have running for your region and go to everything is going to be, it's going to be a new reality here where everything's going to be, the town hall meetings are going to be virtual. All of that stuff will be virtual now. So they're really, I think the people that are going to be running for office are going to have are going to be struggling with how to actually get out and meet their constituents. So it's a good time for people to do some advocacy and get out and introduce themselves virtually, through email and phone calls and stuff on that. And I think, just to let two other things real quick, because there's been a lot of talk about the economic impact payments and how that is not counted as a resource. But we are, along with some other DD councils throughout the country, are going to be, we're going to be working with the Iowa Department of Treasurer on if a family or a person does not actually need that stimulus funds to help recover some of the costs related right now, that it would be a good time for them to invest that in an Iowa Able account. And in that way, for sure, if they aren't able to spend it within the 12 months, it won't be counted as resources if they have that in that account. Be on the lookout for some marketing stuff that we're going to be putting together, hopefully for the Department of Treasury here in this next week. One more thing I think I had. We did, I think some of the providers that are on today did apply. We did relief release what we call the COVID-19 relief fund to help. It wasn't a huge chunk of money. We were only able to offer up to $1,000 per provider or organization to help with some of the relief with COVID-19. So whether it be if they wanted to help with doing some social isolation things, like buying hotspots for their folks in their community apartments, helping do some direct care support. We had one provider that bought a bunch of gift cards for their direct support providers to pay for a dinner for a night. So we were able to award 31 of those. So the council invested about $31,000 in that type of support. And so we're on the fence right now about whether or not we're going to be able to release some more. But we were able to release that money for everybody that applied for that received it so far, I should say. I think.
Brooke, I'm sorry to interrupt. We got a question. Are those grant opportunities still open? Is there any option for folks still to apply for that?
They definitely can apply. I'm looking right now to see if we have any more funds that we can actually set aside for that. But right now I don't have any applications that haven't been approved, so.
Great, thank you. If folks need it, we can put the application, we can link the application to our resources as well.
Yeah, I can put that right now. And we have some COVID-19 resources on our page too that are in like kind of plain language text for folks to understand. So feel free to check those out too.
That's excellent. Any other questions or comments for Brooke? Brooke, thank you so much. That's a lot of great information. Kirsten, do you want to share anything about the information that you pulled together in the document for educational resources?
Sure. In 4 minutes or less.
2, because we have to wrap up. No.
No, it's good. Yeah, I do not need to say very much. I can talk really fast. I appreciate all of this information and having it all in one place. And I think this group is such a diverse group, and all of us are gathering information from a variety of places, and to have it all right here in the same place is good, I think. I think we in education have found, like many of you have talked about, that learning to do things a new way is not a bad thing. That definitely we want to see our students and be live and in the same place with our colleagues and our students. But we've learned that we can do a lot of things virtually as well. So I'm going to share really quickly the links. I'm not going to open the links or anything, but just talk through the Iowa AEA site here. There are several links that are really kind of need specific. So OT, folks with hearing issues, folks with vision impairments, folks who need physical therapy, that kind of thing. So resources for teachers, parents, who are supporting students. I know they are adding to this that there's a transition document that's coming into this that will have some transition specific resources as well. So this is kind of an ongoing work in progress. And then down 2 lines to the Iowa Department of Ed link. I'll just say there is a ton of information on here. Much of it probably not anything that any of you would need professionally, but maybe personally because of having kids, grandkids, neighbors, whatever, accessing school services. There are a lot of resources here. The Family and Educator site just has a ton of resources around supporting kids with virtual learning, broad stuff as well as content specific stuff. Obviously, the school meal services is kind of self-explanatory. Some stuff about community colleges. There is a link specific to special education and rules and guidance and directions around services in a virtual format. The continuous learning plans, all schools were required by April 10th to submit a plan for whether they were going to be providing voluntary services or required services. If they provide voluntary services, it is exactly as it says. Kids can choose to do it or not. They're not graded. Attendance isn't taken. They're not presenting lots of new content and new learning, but enrichment and support around the learning that has already taken place. If they are doing required learning, then they are taking attendance, they're grading, they are continuing with the curriculum where they left off. Most schools in Iowa have chosen to do the voluntary, although they are able to change, and schools have changed, flipped back and forth. Some schools are doing required for their high school students and voluntary for their elementary students. So there's really a variety of different options. And you can go on to that link and see what your district has chosen or districts that you're interested in, so you can kind of see what the plan is. Translated information, so there are some documents in various languages. And then the COVID-19 recordings for administrators in Iowa. If you click on that link, generally twice a week, we have a webinar that is recorded that all administrators across the state are invited to attend. And when you click on that link, it will show you what the topic was for each date. So if there is specific guidance you're looking for, you can go find where that was discussed and go in, or you can spend hours and hours and just listen to all of them if you choose. And then some general COVID resources. So tons and tons of information. And I think that's one thing that we're all learning is that there's an overload of information and it's hard to sort through it all. Having it in an organization like this table will help, but again, still just so much information. It's hard to keep up on all of it, but hopefully that will help you. Does anybody have any questions about the education stuff?
Kirsten, this is Nancy Hunt. Can I add one thing?
Absolutely.
We also Iowa received 71 million in CARES Act funds, and so schools are, the application for school districts opened up today, and they have until Monday to complete that application. And it really is just designating indicating which allowable category they want to use their money. But 90% of that money goes directly to the districts, and they should receive their funds by as early as May 13th. And of course, when they can do anything that's allowable under IDEA, any services, as well as use it to provide more equitable services for students on IEPs and students who might not have the technology, etc.
Wow, so that's due Monday, Nancy, is that what you said?
Yes, the application is due Monday. It's through CASA.
Okay.
Kirsten and Nancy, we did get a question that came in that says, have you heard that kids with disabilities are unable to receive assistance through the schools with distance learning because distance learning is not specifically addressed in the child's IEP? Can you address this?
So, Nancy, do you want me to start and you can jump in?
Sure.
So, it's really complicated because if the school is voluntary, then they aren't really in session. The only schools that are technically in session are schools that are providing required services. So if the format of that school is voluntary, then all students are receiving their education in a voluntary manner in the home setting, which is not IEP. The IEP does not directly impact. The IEP directly impacts school services. So only if a district is required are providing required education, does the IEP have precedence? Now, that being said, even with voluntary, schools are being encouraged and supported to provide accommodations and supports to help all kids access education to the fullest extent possible. And lots of districts are being very creative and hands-on. I mean, they're really digging in and doing this even in a voluntary environment where it's not required. But it is touchy in the difference between voluntary and required. Nancy, would you add anything to that?
Just that equity should be considered even in the voluntary, but otherwise what Kirsten said, I didn't have anything else to add other than I think teachers are doing the best they can trying to determine how they can reach all students, but having to be creative as everybody is right now.
Leanne, does that answer the question?
Can I just add a school district perspective?
Yeah, I think it may be an individual school district perspective. The school district that I'm particularly aware of is Ankeny, and a child that has some significant disabilities that needs a lot of assistance with the assignments that are coming out from the school, and the parents really feel like that assistance isn't there for them. So that's the reason for the question are they required to make accommodations for distance learning? And this particular parent was told because it's not documented in the IEP that they're not required to provide any type of assistance to the child with distance learning.
Yeah, this is Mark Schneider, and I guess I would just like to add, let's not group all schools into the same group. I think, as Leanne pointed out, I think it's individual school districts are doing what they feel is best for their students in their school district, and obviously that can depend on a lot of factors. But I know there are some school districts out there that are having multiple IEPs daily with families to try to figure out what they need to do, whether it's voluntary or required, to figure out what they can do to best provide for their children's learning. So I guess my advice would be to anyone that's attendance today is if you have concerns about your child in your school district, that pick up the phone, talk to the child's teacher, talk to the child's special ed teacher. If you feel that you're not getting anywhere there, talk to the principal, because obviously in this situation where everybody's spread out, not everyone is aware of everything that's going on. So talk to the principal. And if you still don't feel satisfied after doing that, pick up the phone and talk to the school superintendent. Work your way up and make your concerns known. Please don't suffer in silence. The only way we're going to get through this is if we all work together. In a very trying situation, there are going to be frustrations, and we just need to talk about it and work to what's best for those individual children.
That was perfect, Mark. That was perfect. Yeah. Because everybody's trying to figure it out, and some of it is, like you said, a different district might approach things differently. Different teachers within the districts have different levels of comfort with the technology and haven't been prepared to do this. So they're learning too. But you're right. If we don't communicate about it and try to figure it out together, it's not going to get better. So
I used to say that we're building the airplane as we fly it. And now I say we're trying to build the boat as we try to fly it.
So that's great. Thank you, Mark. Thank you, Kirsten. Thank you, Nancy. We had one other question that had come up earlier that I just wanted to, I know we're over time, but it wouldn't be a coalition meeting if we weren't. So I think we're close, but the question was, has anyone been providing rehabilitation services remotely? Do we have the ability to fund this?
I suppose I could answer that from a Medicaid perspective. I don't know the specific providers that are out there maybe delivering this, but yes, we are aware that there have been day habilitation providers that have been able to figure out how to provide day hab services via video conferencing or teleconferencing with day hab members, either doing different classes that folks can log into, working on skills through video conferencing. And yes, we will pay for any Medicaid service rendered via teleconferencing, video, chat, iPhone, iPad, whatever, as long as it's clinically appropriate to the member's needs. So if you have a member that's 100% dependent on hand-over-hand staff interactions, telehealth may not be appropriate for them. But if you have folks who can participate in classes, who can participate in skill-based training through video chat or through telephonic instruction, that type of thing, that's perfectly appropriate during these times.
Thank you, Leanne. Thank you so much. I think that we got all the questions. Jess, I don't know if you saw any others that, so I think that we got most of the things. I wanted to remind people that our next coalition meeting is August 20th. And right now it's scheduled 10 to 3 at IVRF. So hopefully we'll get to see each other in person. If not, we will go with Plan B, which seemed to work pretty well today. There will be some other resources that are on the sheet that I share. There's some really great resources. I just would like to point this out really quick if folks don't mind. There's some really nice resources for through the Administration for Community of Living. My screen will pop up here in a minute. And specifically something that I thought could be really helpful to folks is if you continue to scroll down, resources from our non-federal partners, and there's a number of fabulous resources here, but for example, and I know Bill, you shared some good resources with me earlier that I sent out, but like here's an example of information for people with developmental disabilities and self-advocates, and it lists just a number of different things that can be very user-friendly for people around self-care, just a number of different things. So that resource is on the sheet that I'm going to share. We also have a resource that is advancing states funding and grant opportunities for COVID, which has a number of different resources on it as well. I've included a link with all the Independent Living Center information in Iowa. And then also, I did include an updated employment matrix. For those of you who haven't seen this before, this is all of the Medicaid employment service categories, and that outlines the scope of services and provides a lot of detailed information in each category, but don't get dizzy, I'm gonna go to the bottom really fast. But this is updated with the Iowa Total Care information, and so you have contacts here for Shauna with Iowa Total Care, and of course AmeriGroup's information for their employment specialists. So if you're wondering like who to reach out to, there's some information on this, and that'll be it, that's also included in the links. So that's a highlight of things. I just want to thank everybody so much for your time and your willingness to come together this way. I want to thank all of the speakers who shared great information and those who submitted things in the chat box. And please stay safe, be well, and I hope to see your faces again soon. Thanks, everybody.